Hello everybody, I'm going to run through the slides on skin fairly quickly. There's a lot of them, so hopefully I'll get through them fairly quick. I appreciate those of you that have done the NDNQI site because I think it's a pretty good site to kind of get you some hands-on of kind of assessing and making decisions on treatment, and that really is the end result we want you to get to. Of course, older adults have skin problems. The structural integrity of the skin is diminished, which is the protective function, and the skin's purpose is to really protect the internal organs and structures. Also, some chronic systemic conditions can cause skin problems, so you'll see different kinds of rashes and different kinds of things depending on what kind of disease process that they have. These are just some common skin problems: xerosis, pruritus, sunburn, urticaria, and you'll see terms like this in the chapter that deal with specific ailments. Make sure that you're trying to commit to memory some of those terms. You will see them again, particularly in history and physicals. They may not say hives, they may say urticaria, and then you're thinking, what is urticaria? So terms are important because you are going to come across those quite a bit. These are the phases of wound healing, and when you have a little bit more time in your patho class, you should get into some more information about the actual healing process. The process is typically dealing with intentions: first, second, and third intention. First intention is where the edges are brought together and the skin's lined up well. Second intention is kind of a deeper tissue injury or wound where it's going to have to granulate and contract slowly. And third intention is kind of like one of the ones we looked at in the slide the other day with delayed closure that are high risk for infection and are probably going to likely result in a scar. These are some of the definitions that you would have seen in the NDNQI. Partial thickness wounds, that's just kind of the definition where it's damage to the epidermis and the upper layers of the dermis. It usually takes 5 to 7 days for re-epithelialization, but that only occurs if the right conditions are in place. And sometimes if there is very poor circulation or there is very poor nutrient and those kinds of issues, or if the partial thickness wound is in an area that is likely to become infected with fecal material or laid on a lot, then it may take longer than that. Full thickness wounds is when it extends into the lower layers of the dermis and underlying sub-Q tissue. And these are ones that the granulation has to help heal, and then contraction develops. This is some good pictures of how epithelial tissue cells fill in the space. Pressure ulcers they're a compression of the skin and underlying soft tissue between a bony prominence and the external surface for an extended period of time. And just like you can see, there's certain areas that tend to have more of that bony prominence and more pressure in terms of weight on them, and so those are your high risk areas. Just like we talked about in surgery, that those same kind of things occur because of friction, of being pulled across the bed, turned and pulled. The more dependent a person is, the more likely they are to have friction as well as shear type issues that help develop these ulcers. The big thing is identify high-risk patients early. You're going to have a pressure ulcer risk scale done that's done typically every day in a hospital. You're going to do what normally most places are using, the Braden scale. You also do a nutrition assessment on admission to the hospital to look at if there's other things that need to be done. These, of course, are all the contributing factors. Make sure that you're very well aware of everything that can cause this. Some of you guys have seen a lot of these in clinical already. Know that hospitals have all different kinds of pressure relieving techniques. Some of these are devices. Some of it might be capillary closing pressure, like we talked about with wound vacs the other day, and strict positioning that needs to be very regularly done and religiously taken care of. If you're delegating that to someone else, you want to follow up and make sure it's really happening. And these are some of the pictures that you've seen, similar ones with doing the NDN-QI site. These are just ways to kind of determine which type stage that you're dealing with. A stage 1 is not broken, is one of the key things to note about it. Stage 2 is when the skin actually begins to break open with a partial thickness skin loss of the epidermis or dermis, but it's usually more superficial. Stage 3, you can see, is a full thickness skin loss where you begin to see subcutaneous tissue and underlying fascia. Sometimes there can be some necrotic area around the edges, but you don't see bone or tendon or muscle exposed. And then stage 4 is when it is a full thickness skin loss with palpable exposed muscle, tendon, or bone. And with these, you often can have what's called undermining and tunneling, which means that there's areas that communicate under the skin from one area to the other and may cause little sinus tracts that have fluid and extra infectious material within them. When you're doing a wound assessment, you need to make sure that all these characteristics are identified and noted. Most places like for you to do wound assessments daily and with every dressing change, so be aware of that you should really be looking at the size, color, the stage, everything that you can that describes it, so that from one shift to the next, one day to the next, a week from now, you can tell if you're really making a difference one way or the other. Just remember that exposed wound is always contaminated, but it's not always infected. Just because it's got organisms within it doesn't mean that they're affecting it in an infectious standpoint. And so we have to be very careful with wound management and dressing changes because of that. These are just some listings of different kinds of therapies that are instituted. Sometimes you'll have wet to dry dressings that go in these wounds. Sometimes you'll have dressings that are meant to absorb some of the exudate fluid that comes out of wounds. And so the ideal thing is to keep the area not full and pocketed with fluid that's draining out of the patient. You want to absorb some of that. But if it's a fairly pink, moist wound, then you want to try to keep it a little moist and clean, so that it kind of stimulates the growth and epithelialization and granulation to kind of close back in the wound from the inside out. And again, the vac helps with that. And then there's some things called skin substitutes that can kind of be placed in the wound. Hyperbaric oxygen therapy is another thing that sometimes in wound care centers people will go do. That's typically not done in the hospital setting unless they're maybe on a burn unit or something like that. But patients who come in for therapy on an outpatient basis will usually go for this in some situations with long-standing wounds that aren't getting enough oxygenation to heal. These are just, again, another picture related to debriding and kind of some things that you would see in surgery. Bacterial infections we've already looked at. These are some other common looks to a bacterial infection. Someone may look at this and think that looks like cellulitis of the face. Here's another one that looks similar but much smaller in a different location. Viral infections may have this type of look, more spotty and red. It's another example of some viral infections. What does anybody think when you see this viral infection around the face? It's likely herpes. This is fungal infections of the fingernails. You can see how those have turned. A lot of times you'll see that in elderly patients who aren't able to really do good toenail care as well. Here's another example of fungal infection of the scalp. And just, this looks like a fungal infection like ringworm. You can see severe fungal infections of the throat, and you see those a lot of times in very debilitated patients and in cancer patients. So always be looking in the oral cavity of patients that you think are potential for immune problems. Again, with skin infections, skincare has to include proper cleaning, isolation precautions if it's something that can be communicated to other patients. Sometimes they're going to be put on antibacterial drugs. If it's a fungus infection, they're going to be put on antifungal drugs. And sometimes just to reduce the swelling and the discomfort, they may be put on anti-inflammatory drugs as well. These are just several other pictures that show you this is kind of like a pictures related to head lice infestation. It's one that also is showing you scabies. And you have different other types of bed bugs and bed bug bites. This is eczema of the feet. And then some pustula eczema of the hand. So I won't read all these to you, but make sure that you go through and look at all of these so that you kind of get an idea of what a lot of different skin conditions may present like, and have pictures in your head that kind of go along with this. Psoriasis is one that a lot of people do have, and so you can kind of see what some of the treatments are there. Corticosteroids, tar preparations, other topical therapies. Sometimes they're put under an ultraviolet light, and they typically need lots of social and emotional support, because as you can imagine, it's very traumatic to have this and it be some type of skin condition that's very visible. People tend to not want to shake your hand or do things with you because they think there's something wrong, because it's usually in an area of the body that's visible to everyone else. These are some benign tumors. Usually they're kind of crusted, but not usually really, really dark. The one on the left is keratosis. The one on the right is a keloid. You have a sebaceous cyst, and then another one towards the eyelid. These are just some other examples of different things. Now, when you start looking at some of these lesions that are very dark in color, particularly the one on the bottom right, that is a melanoma. The one on the left is a squamous cell carcinoma. So those kind of really irregular edges and often kind of dark purplish black colors are usually one that needs to go and be seen by a dermatologist. When there is skin cancer, these are just some of the treatment options that you can see. Cryosurgery is when they kind of freeze it. Sometimes they do kind of burn them off, which is when they do this curettage and electrodesiccation. Sometimes they cut them out, which is excision, and sometimes drug therapy and radiation therapy as well. These are just some other pictures. And then I know that you've already done lots of questions and answers, so I won't belabor all the case studies in here, but it doesn't hurt to kind of review these questions one more time and make sure that your memory on these is still intact. you want to know what is an appropriate dressing for the type of wound. So hopefully this has been a fairly good overview of just some of the basics that maybe adds to your NDN QI experience.